And it's Anita Lambert, your holistic health physio, and Hannah Rost from Vital Physiotherapy and Wellness.
Hi, everybody.
Hi, Hannah.
Hi, honey. How are you?
Good. How are you doing?
I cannot complain.
It's nice to see you. Today, yes, you too. And today we're really excited because we're going to be talking about very common condition that both of us see, whether in our pregnant clients or postpartum clients, and that is pelvic girdle pain.
Yeah.
And most people are told that this is just a part of pregnancy or postpartum life, and you just have to deal with it. And we want you to know that you don't have to put up with it.
Like most things, you don't.
Yes, exactly. Core and pelvic floor related. So thank you so much for joining us. Please make sure to say hi and let us know you can hear us. And if you have any questions throughout the live broadcast, let us know. And if you have questions and you're watching the replay, make sure to comment below and we'll be sure to get back to you as well.
Yeah, awesome. And I mean, a lot of people have asked us, we posted about this, that we're talking about pelvic girdle pain, and people were like, what are you talking about? So just so we're clear, pelvic girdle pain is really any type of pain, and I'm going to ask Anita to demo with our lovely pelvis. Is any kind of pain that's around the pubic symphysis, so it's that lovely area that joins the thick piece of cartilage that joins the two beautiful butterfly-shaped bones of the pelvis. The sacroiliac joint, which is if you can flip around, it's at your back where your sacrum, which is like that tilty piece in your pelvis, meets those beautiful pelvic bones again. Your tailbone or your coccyx, and that's for those of you, it's down between your bum cheeks. Your hip joints, and sometimes it radiates down into your groin as well.
So either side or down into your groin. Let's see.
Yeah.
Down there. Yeah.
And the funny thing about this kind of pain is sometimes it can be on one side, sometimes the other side. It's a little bit inconsistent, and as we'll chat about today, there are certain kind of hallmark signs that we know that this is more pelvic girdle pain. There's a lot of out-of-date information out there, and so one of the big things we're going to do tonight is talk about the incorrect information and the myths and bust those guys, and get you some really high quality information so that you can take care of this on your own or go to your neighborhood friendly pelvic physio and get that dealt with as well. Please send in your questions. Please send your comments. Jump in either during the live broadcast or after during the replay. Anita and I will do our very best to respond to those as quickly and as timely as possible. So should we do this?
Yes, let's jump in.
All right. So I think the very important number one question is, what is pelvic girdle pain?
Yes. So Hannah just talked about it, but for those who are just jumping on, we want to make sure you know where in the pelvis that we're talking about, because pelvic girdle pain is kind of a broad term. So you may have heard of pubic symphysis dysfunction or pubic symphysis pain. So that's pain right in the front. That's pelvic girdle pain. Pain in the hip, there we go, the hip area, or in the groin at all, or in the SI joint or tailbone area. So that is all pelvic girdle pain. And so some common symptoms, if you're experiencing this now, or maybe you have in the past, so pain with walking, pain with standing on one foot. I know a lot of clients tell me it's, pain when I'm putting on my socks, putting on my pants. This is really common. Doing stairs and trying to turn in bed. This is really, really common. And some even talk about this like pelvic waddle, that you kind of feel like you're just not having that smooth walking stride you're used to having, and that there's pain with this. So we want you to know that this kind of pain is very common in pregnancy and postpartum, and we think it's common. So there is this kind of myth that, well, because a lot of people go through this, then it just must be a normal part of these,
what do you expect? Pregnancy. You're pregnant. What do you expect? You had a baby, right? Yeah.
So our big goal for you is to know that you don't have to put up with this. And again, just like any other pelvic floor or core issue that we've talked about, it's just a sign that whether it's muscles or certain areas of your body aren't necessarily working as well as they could, and that you can definitely change this. Both Hannah and I see people in our practice all the time with this kind of pain, and it can change and it can go away even while you're pregnant. So you don't have to wait till after birth for it to go away.
One of my absolute favorite stories, I had a a client who was 39 weeks pregnant. She was having trouble walking, and she was so worried about delivery because that's a big worry for a lot of these clients, right? And she came in on Thursday night. She was just one of those clients that like you think about over the weekend. And I was so worried. I gave her a lot of the stuff that we're going to talk about today. And she sent me an email on Saturday and was like, this is still not better. And usually with this kind of symptoms, we say, give it about, once you start doing the exercises and our tricks, expect about 48 hours. That's when you're going to start to see real differences. It's not the kind of thing that gets better immediately, but but it gets better, like for real. And Saturday night, she sent me an email saying it's not better yet. And I was like, oh God, okay. What am I going to do? And I was coming up with this whole plan. And Tuesday morning, I saw her, was her next appointment. And she it was like a catwalk. Like she walked in, she owned the place. And I was like, what happened? You said you weren't better. It's like, it just needed a little bit more time. And all of a sudden she had confidence again for her birth and for her labor. And these things are really, really treatable. And our strategies are really simple. So I find it very exciting, but I guess I have to, right?
Yeah, no, we get very excited when clients feel better. And especially, I think it's how we talked about during pregnancy and postpartum, just because a lot of clients walk into our office being like, well, I'm willing to try whatever. I'm not, I'm not necessarily expecting this, to get better now during pregnancy. And both of us are like, whoa, like it actually can. And it's about solving why this is actually happening to you.
Yeah.
So definitely there can be many reasons why it's happening. But first we want to go over some of the myths or the traditional way of looking at why pelvic girdle pain actually happens and what may actually be the opposite that's causing it. So Hannah, do you want to kind of start that off?
I almost want to gloss over this because it hurts me in my heart and my soul when people come in and we hear these words and the terms that they're using and they're so scary and they're so disempowering. And I just want to just nix these completely, but I'm going to say them just for the sake of our night tonight, because I want people to know this is not actually true. So, very often our clients will come in and say, I have an unstable pelvis. I have instability in my pelvis. And it's simply not true. Like the pelvis is an extremely stable joint. It's one of our most stable joints, actually. And you need to sustain a very large injury, and I say falling off a horse, falling from a height, things that are actual injury in order for your pelvis to be unstable. Pregnancy is not something that's going to cause your pelvis to be unstable. I don't care how many hormones are working their way through your system. Your pelvis is stable and we can keep it stable and it's going to hold that baby in there. So I want people to stop saying this, please. And if you've been told this, it's just not true. Okay. The other thing that we've been told very often is their SI joint is out or there's been a torn ligament. This is super, super rare. I put this in the category of unstable pelvis also. A lot of what we're told is you're unstable, you're weak, you have to strengthen, tighten, and keep your knees together. Everything has to be held together and clenched. And it is the complete opposite of what we often see with pregnancy, right? A lot of what we see is, and to make this like a very simplified version, I just say we have a lot, our pelvis is at the center of our body and a lot of our muscles attached to our pelvis. So our abdominal muscles, our glute muscles at our bum, our inner thigh muscles attached, the front of your hip muscles attached, your back muscles attached, basically all of your trunk and upper leg muscles attached to your pelvis. And during pregnancy and immediately postpartum, there are a ton of changes that happen to these muscles. Some of them get lengthened, some of them get tightened, some of them, where they're used to functioning kind of gets altered, right? Very simplified version of that. And what happens is some muscles are just holding on for dear life. And so muscles that we see that get really, really tight are often the muscles on the insides of of the thighs. Yep.
Yeah. So the muscles that Hannah's talking about, the adductors or the inner thighs, they actually attach into this area.
Into the pelvis, right?
Yeah. Mm-hmm.
We see women a lot of the times overusing their abs, even during pregnancy, just to try to hold it together. And what happens is a lot of it we see also in terms of the posture that clients come in with during pregnancy. In order to accommodate for a large, their belly getting bigger, we start to tuck under, when we start to take our pelvis and tuck under, which actually renders our glute muscles, our hip extending muscles. So I'm going to stand up and demonstrate this. So apologies to everybody. Okay.
Just while Hannah's standing up, I'm going to show you. So with the pelvis, let me see here, the glute muscles, you can see, so they attach into this whole area. So pelvis, they go even along this area and all the way down. So you can see this whole area. They help to, they attach into a lot of part of the pelvis. So if they are really tense or not working as well, it could actually contribute to this pain.
So as our bellies get bigger, in order to not fall forward, what we start to do is we often tuck our pelvises under. But these muscles here at the bottom, like the nice cheek muscles, the bum muscles, their job is to extend your leg backwards. I don't know if you can see that at all. There we go. There we go. So, but once I tuck my pelvis under, right? If I tuck under, I actually have no range of motion for my leg to move backwards. So if I'm untucked, that's my movement. If I'm tucked under, that's my movement. And so those muscles actually get really clenched, but they're not useful. The same way that when we're squeezing our legs together, those muscles get really overworked, but they're not useful muscles. I don't know if that was a visual that was able to be seen there. And so, and what happens is you could just get a muscle imbalance and it results in discomfort. Which we call pelvic girdle pain. And that kind of discomfort can be felt in a whole bunch of different places around your pelvis, but it is often a muscle instability, a muscle imbalance issue, which is very readily resolved. Once we start to clench our glutes and our inner thigh muscles, our adductors, those are synergists. Those are muscles that work really, really closely with our pelvic floor. So we often see, because we had to come back to the pelvic floor today. It had to happen.
It's a part of it though, right? It's a part of pelvic girdle pain.
Yes. Yeah. So the pelvic floor gets really, really, really tight, similar to a lot of the other conditions we chatted about. And so squishing your legs together is the opposite of what we want people to do. And I hope you all enjoyed the visual of my bum.
Thank you, Naomi, for tuning in. Naomi just said she tuned in just at the right time for that visual, Hannah. But that was great, because I think it's important for anyone watching to understand why that bum tucked position doesn't actually help us. And if you're pregnant or after giving birth, you've probably, stand sideways to the mirror. Just kind of, I usually tell clients when they're in my office, when I'm first looking at posture, I'm like, okay, I have them stand sideways to me and I have them shake it out. Don't try to impress me, and just stand there. And generally that bum tucked under position is there for clients who have pelvic girdle pain. Then I have them stand sideways to the mirror so they can see, and they go, oh, I had no idea until someone showed me. So even do this at home, stand sideways to a long mirror, and just notice, and then untuck your bum as Hannah showed you, and it can make a big difference. Yeah, that's great.
I mean, the odd thing is also, we acclimate, we kind of create this homeostasis. So when you're pregnant and you start to tuck under, that becomes your normal posture. And so postpartum, nobody says to you hey, where'd your bum go? What happened? That's become the posture that you have grown accustomed to, and you don't change it, which is often why we see the pelvic girdle pain postpartum, right? As all the muscles kind of shift back into place too.
Yeah, and I often talk to clients too that I only see postpartum and who have pelvic girdle pain, and I tell them, like, when you're pregnant, you were probably standing in this posture, and then baby came out, and your body is still trying to figure out, okay, all this weight in the front is gone, but it's not like your body just knows, okay, I'm gonna put my ribs over my pelvis, untuck my bum, right? So it often, as Hannah just pointed out, just sticks afterwards, and often for a long time afterwards, unless someone points it out, and then you can make that change.
Don't worry, we'll do that. We'll point it out to you.
Yes. Yeah. So I think that's fantastic. So just to kind of run down a little bit of what Hannah talked about. So again, kind of traditionally, it's keep your legs closed, strengthen your inner thighs, that there's this instability around the pelvis or the ligament. You may be told your ligament here is torn.
Because of the hormones.
Mm-hmm. But in the end, it could actually be due to muscle imbalances. So the inner thighs, your glute, like your bum muscles, and then also your pelvic floor. And often there's tension in all or some of these muscles contributing, and posture as well. So again, we're not, we want you to see a health professional to make sure that you find out what your needs are. So we're not saying this applies to absolutely everyone, but this may be something a bit different that you haven't heard about before. So if you're having this pain, you can try some of the things we're about to talk about, but this doesn't replace information by a health professional that you would be able to see in person.
And the other thing I should mention also, Anita, is sometimes people put their hands on their hips. They feel like one hip feels a little bit further forward or further backwards relative to the other. And that kind of feeds into that idea that, there's that instability. And really, again, sometimes it's just that one side tends to be tighter than the other. And sometimes it's really as simple as stretching the side or lengthening the side that tends to be a little bit tighter. And then, balancing the rest of the muscles. Like, we kind of assign these like huge meanings to things, and they're usually quite simple to deal with.
Yeah. No, I think that's great.
So what we do?
Yes. So as we talked about, seeing someone in person can be helpful, but if you want to start trying things as well. So we're gonna show you a couple things kind of related back to what Hannah talked about in just the recent answer. So we talked about there could be tension in your inner thighs, and how we talked about your inner thighs can attach into your pelvis in the front, so kind of the groin area. So one of the things that you could do, so instead of actually clamming your legs closed, what actually can help is a gradual opening or stretch. And I'm going to pull up, this is a yoga posture, so it can be called reclined cobblers, tailor's pose. There's a lot of different names for it. So I'm going to let's see if you can see there. So this is a pregnant person who is on their back in that position, so with the knees open.
Yep.
Now, what I find sometimes when I have clients do this with pelvic girdle pain, there can be hesitation about it because they've been told keep their legs closed, or the inner thighs are just really, really tense. So you may not go into that position just letting your knees open. What I'll have clients do is actually stack pillows under their knees on the sides, and I have them stack as many pillows that they need so that they can rest their knees open. It's important that you relax into that position. So you may need 1 or 2 or 3 pillows under each knee so you can relax into that position.
Or, anything that kind of makes it easier for you.
Yeah. So, that is something that can be helpful, breathing into that position, or massage of the inner thigh. So whether it's seeing someone for that can be helpful as well. I also give clients, I call it the pelvic symmetry exercise series. And it's a combination of movements. Yeah. That this is one of them that goes through one of them. So one of those things we're talking about, so to summarize, is helping to release inner thigh tension can actually help.
Right.
The second part, so another one is the glutes that Hannah talked about. So your bum muscles, they may be tense and also weak. So to release tension, if you have a tennis ball, or I know some people use lacrosse balls, kind of depending how much intensity that you want.
My favorites are yoga tune-ups now. I'm obsessed with the yoga tune-up balls. Oh,
yeah,
love them.
they're not too hard, but they're not too soft kind of thing.
Yeah.
So using that, or tennis ball can work well. And I like to show clients against the wall. So kind of a release. It's like a self-massage for your glutes, for your bum muscles to gently
You put
release.
a ball on your bum, people, is what Anita's trying to say.
Yeah. And you put a bit of pressure into the wall. But also, again, with this, I tell clients, don't be jamming into the wall so hard that you end up like cringing and tensing up, because then nothing is going to release.
Yeah.
So you want just enough. Yeah, you want just enough pressure. You feel a little bit of tenderness. You're going to deep breathe through it, and you're waiting for that tension to go. So doing that on both sides can be helpful too. And then, as Hannah also demonstrated, to release your glutes, and as well to
it
let
all
them
comes
activate.
back to me showing you my bum. Yep.
Yeah, it's that posture. So if you're watching this and you're not sure what we're talking about, once we're done, the replay will be up. I want you to rewind and go back to that part. So you'll see Hannah talked about untucking your bum when you're standing. So if you've heard us talk before, we talk about ribs over pelvis posture. And part of that is untucking your bum so that your bum muscles can actually do their job. And then the last part we're talking about with this kind of muscle balancing is the pelvic floor. Now, this can be a little bit more tricky for you to know at home, that sometimes there can be tension in these muscles. And in that case, we want to release that. And that can be done if you see a pelvic health physio, they can teach you how to release tension in your pelvic floor. But then I also have clients that sometimes it's not a tension issue with the pelvic floor. It is elsewhere, but the pelvic floor just needs to learn how to activate and activate evenly on both sides. Right. So that's a little bit trickier to know on your own. But if there's tension there, or if you have a history with pain with intercourse, or using tampons, or during pelvic exams, it could be a sign that you have tension in these muscles. Right. And we talk about breath work and using the flower bloom breath. We'll link it below. We're going to link all the resources that we talk about below, so you can get an idea of how to release tension in your pelvic floor if that's part of the issue for you. Yeah. So those
usually, like I with my clients, I won't even do an internal exam when somebody comes in for pelvic girdle pain on the first time. Usually, there's so much other release work. What I have found is that often, if the pelvic floor is going to be really overactive, it's often compensating, and it's not the root of the cause. It's just trying to compensate for all this other stuff going on, and it's much easier to get that release once they started to integrate these other stretching and strengthening exercises.
No, I totally agree. Doing lots of external release work to start, and then teaching. So if you see a pelvic physio or another health professional, they should be teaching you things that you can do at home to, again, address that issue, because it's something you're going to need to do. It won't be kind of a one-time release and it's gone. It's likely been lingering there for a while. So it'll be something you want to keep up at home.
Out of curiosity, Anita, during pregnancy, if somebody comes in for pelvic girdle pain, how often do you tell them to do their stretching and glute activation and stuff like that?
That every day, at least once a day, often twice a day. So that symmetry kind of exercise I was talking about, I'll often be having them do that twice a day. But then there's other habits that can be super helpful during the day. So as Courtney, yes, hi. Oh yeah. So Courtney is saying my doctor didn't give me much advice, just to use heat. So I'm excited to try this. So that's excellent, Courtney, and keep us posted. Yeah. So I think definitely in terms of Hannah talked about kind of that idea of like knees open, and we'll talk a bit more about that in other exercises, but we're going to give you exercises to do and some manual release work within the session. But then the other thing important to know is habits during the day. So I'll often tell clients to actually sit with your knees open, which a lot of times as women, we're told to sit with our knees together, which actually can provoke this kind of pain. Yes. So knees open. If you like to sit cross-legged, I know this is big news. We're not going to tell you not to sit cross-legged, except if you do sit cross-legged, like as in if you're sitting in a chair with your knees crossed, we're going to tell you to sit with your knee open and your foot crossed, which is different.
Your ankle over the knee, basically.
Yes. So not your inner thighs crossed together, your knee will actually be open. And that position is actually a good thing. Yeah. So
knees wider than hips, basically, as well.
So we're talking about, exercises and release work, but all these habits during the day in itself are going to actually help your pain as well.
Right. And thinking about that posture throughout the day, because if you do your exercise and your stretching and then you go back to sitting all day with your knees together, sleeping all night with your knees together, walking around trying to keep your knees together, throughout the day, if you spend, 15 minutes doing your exercises, but then the other 23 hours, 45 minutes with your knees together, what are we going to get rid of that pain? I'm going to say no. But so those habits are really important throughout the day, and they're a little tricky, but they work.
Once you get the hang of them, though, it's really helpful. And another thing we talked about, so super common pelvic girdle pain, is turning in bed, right? And you may have been told, keep your knees together to turn in bed. We're going to tell you, actually don't do that. We're going to post a video I did a little while ago. We'll post it in the comments, so it goes over the posture Hannah talked about and how to turn in bed to help get rid of this pain with turning in bed. And you'll find what I talk about is actually using your bum muscles and actually keeping your knee open, so you're not using your inner thigh muscle.
Right.
So we'll post that below. So it's just a different technique. What it does is it helps to activate muscles around your pelvis a little bit differently, which can actually help your pain quite a bit. So if you're having pain turning in bed, make sure you check that out below as well. And Naomi posted, what does knee open in a cross leg look like? I'm lost. Hannah, there we go, perfect. Hannah's awesome at being able to get the camera to.
I don't know.
So Hannah, here? Yes. So this is the knee open.
This would be cross.
Closed. Yeah.
Right? This is how, this is our, don't do that.
Yeah.
And this is how we would sit. I don't know if you can see the difference.
Yes.
Is that obvious?
Yeah. Mm-hmm.
This angle here?
Yeah.
Okay.
Yeah. Yeah. So that definitely.
My house.
Yeah. That was great, Hannah. Thank you. Let us know, Naomi, if that's helpful.
That was clear or not.
Yeah. Because it really helps, because I think a lot of people assume that as physios, or if you see any health professional, they're going to tell you, don't cross your legs.
Don't.
But actually sitting with that, oh, good. Naomi says yes. Yeah. So awesome. Because sitting in that position is actually a way to release tension in your inner thigh and your glute, and you're not even doing work. This can literally be when you're at your computer at work, when you're sitting at home, or at any point. It's a way of actually stretching those muscles without even trying, which is pretty awesome. So
pigeon pose, but
in sitting.
Yeah.
So it can be super helpful. And then also with sleep, good, Courtney mentioned, so this is my biggest problem right now, and it makes for a painful sleep. Yeah. And especially in pregnancy. And I think, Courtney, you said you're 33 weeks, going into 33 weeks.
So we've got 7 weeks for you to be pain-free, Courtney.
Yeah, and it can totally happen. So we're going to be posting it after how to turn in bed, and it works for so many clients. Yeah. And like I said, this is not really a technique you'll see on Google very often, or be told about. And we're going to be talking a bit about resources. So where a lot of this information came from is actually a physiotherapist in the Netherlands. So we'll talk a bit about that in a little bit.
Yeah.
So hopefully that was clear in terms of, we talked about some ways to help this pain. So again, we're not replacing if you're seeing a health professional. These are things that you could try at home to see if they can help. And if you haven't seen one and you try these things and it's not helping, it's important that you go in to see a health professional to have an individual assessment. So we talked about releasing tension in your inner thighs, releasing tension in your glutes, letting your glutes actually do their job, and potentially releasing tension in your pelvic floor.
Yeah, and posture throughout the day, right? Knees wider than hips. And one thing that I will mention also for the sleep position is a lot of our clients really love their snoogles. They love their snoogles. And the snoogles is like that J-shaped, pillow, like pregnancy pillow. And the thing is, it's just not enough. It's support. It's not enough support in between the knees. I think we were chatting before we went live. Very often, our clients need three pillows. I'm a small person, child size, if you will, and I needed 3 pillows between my knees. So I'm assuming individuals who are more adult size, not sure what that's like, but I hear is they require more pillows between their knees in order to be comfortable throughout the night.
Mm-hmm.
Yeah, a couple of questions pop up.
Yes, I know we're going to get to. So Jennifer asked, turning in bed has been my biggest problem. I saw a pelvic physio specialist last Friday and it helped. I'm just looking forward to more tips. So that's amazing, Jennifer, and keep us posted. And I'm so glad that you saw someone, because again, they can really get you started on a lot of great tips and what's specific for your body as well. Yeah. And then, I hope I'm saying this right, Lena. Is it Lena? She is asking, would you recommend foam rolling the glutes and inner thighs? Yes, that can be fantastic. Yeah. So when we talk about tennis ball release, we're also saying foam rolling. So everyone's a bit individual, and especially as you get further, if anyone who's pregnant, you may find the foam roller challenging balance-wise. So it's really whatever works for you. So foam rolling.
Whatever you have around, right? Like, you know, don't go out and buy a foam roller if you don't have one yet. But if you do, go for it. Yes, it's a great tool.
Yeah. Oh, excellent. Courtney said she's definitely going to try more pillows tonight. Yay. Excellent. And it is one of those things where these are suggestions. It's very individual. So I have some clients that need 2, some need 3. Some prefer not having any, and it's still their pelvic girdle pain gets better. So to know that these are tips and just ideas for you to try and see what works for your body.
And I'm going to add one more tip into there. Mm-hmm. I can't stress the importance of a wedge pillow enough during pregnancy. Sleeping with the pillows between your knees is awesome, but if the rest of your body is twisted awkwardly because you're not supporting your belly during pregnancy, that's a huge factor as well. So putting some either a rolled towel or a wedge pillow underneath your belly if you're sleeping on your side at night is a huge help as well.
Mm-hmm. Yeah, exactly. And I have some clients, if you can't get a wedge pillow, then even, playing around with bath towels, like folding a bath towel, just to give you a little support. And depending where you are in pregnancy and depending, things will change throughout pregnancy. Like I remember personally, it was like between 20 and 25 weeks. I loved my snuggle. It was great. And then I absolutely despised it after that. It wasn't comfortable because your body keeps changing. So again, just to know with pillows, may feel great for a certain number of days or weeks, and then it doesn't. Don't be frustrated about it. Just try something new. It's just that your body and your baby is growing and changing, and that's a good thing. So just finding things that work for you throughout pregnancy, but also then postpartum as your body continues to change as well.
It got to a point in my last pregnancy, I was like, I felt like I was building a fort every night because I had so many pillows.
Yes, yeah.
But I slept, and that's all that matters.
Exactly. As much sleep as you can get, right? So, Hannah, why don't we go into, we've already talked a little bit about some exercise, but why don't we delve a little bit more into exercise that may help pelvic pain and maybe some things that could be helpful to avoid. But again, for everyone, it's going to depend. Everyone is different. So, yeah.
Yeah, I think that this is our big question that we get. And it's, people are really disheartened when we give you this answer, but like, it really depends. Honestly, if we're going to speak specifically about tension and really tight muscles and really, squeezing the people who walk around really, really tight, squeeze together all the time, of course, our suggestions can be create balance. So find a yoga class that you love, do some stretching, doing some release work. If you're somebody who tends to be really, really tight, that's going to be an amazing, amazing exercise for you. Having said that, if you're currently doing exercise and you love it, chat with your healthcare provider about how to optimize that during, given your current circumstances. We stop saying you cannot do X, Y, and Z. It's more, how can we do it? How can we make this possible for you, given that you're experiencing these symptoms? So sometimes it just takes a little tweaking. I find a lot of the time with my clients when they're doing their glute bridges, they're going, and they're doing a glute bridge. And and all it takes is for us to be a little bit more mindful about pre-activating some of our muscles and being thoughtful of how you're doing that exercise for it to be a really awesome exercise.
Oh, it looks like Hannah's frozen on my end. Can anyone comment? Does she look frozen from what you can see?
The other thing that we chatted about.
There we go.
Oh, am I back?
Sorry, you're back.
So it depends. It depends.
And I would totally agree. And just even like a little story about that. This past year, I've seen a lot of CrossFit. Frozen. Okay. Hopefully she's back. I've seen a lot of CrossFit expecting moms and new moms, especially in this past year. And, for example, something that may cause pelvic girdle pain is kettlebell swings. So in one client, which stands out in my head, that was one of the things that was quite painful. We did all this work. She needed a lot of release work, all of that pelvic symmetry exercises. And then by the next time she saw me, she was back doing kettlebell swings. So it was a lot about posture and release work. So just to remember, seeing a health professional who is really up to date about, these techniques and keeping you really into activity you love. Han and I talk about this all the time. Like if you have someone telling you to do all these activities you hate doing, that's not really great either. So yeah, so if there's a way to modify, you should be told how to modify. And it could be that you need to modify and do certain things at the same time, or it could be certain things just need to be taken out for a period of time while you work on these things and then reintroducing them. So
there should be a plan about how to reintroduce.
Yeah. So it does. It all depends on that.
I love it. And so, and Anita, you were mentioning earlier about this, a lot of the techniques that we use for pelvic girdle pain are from this awesome physio. Her name is Cecile Rost, and she's from the Netherlands, and her whole practice is actually in pelvic girdle pain. And she travels around the world, and she's taught people around the world who also teach healthcare providers about how to treat pelvic girdle pain. And so we'll put into our resources. I guess we're giving away all our resources ahead of time, huh?
Yeah, we're talking about them.
All right. God.
Yeah.
We wanted to make you wait to the end, but
we'll definitely,
because she has an app, like she has some great stuff that makes life really, really easy and makes this as simple as possible. And she has a great book as well. A client of mine just texted me and said she just bought the book and she just loves it, and really easy to understand and simple and really effective.
Yeah. So we'll go over those in a little bit in the resource, or if you're a health professional, or if you're working with a health professional that you want them to take this course, it is available for any health professionals. When I took it myself, there's a lot of physios, but there were chiropractors, massage therapists as well.
For sure.
And it's probably one of my favorite courses I've ever taken and works super well. A lot of the techniques we learned. So that's kind of part in terms of exercise. What would be some exercise, Hannah, that traditionally people are told to stay away from, and what's your kind of opinion on
that? That's a can of worms, my friends. There are certain things like that people have, like anything that is, squats, lunges, things that are knees wider than hips. People have been generally told to stay away from. Not to stand on one leg, not to do, I think that once you can resolve this, like everything is kind of game, right? As long as you feel up to it. Having said that, we talked a little about people who kind of feel like one hip is a little forward or backwards relative compared to the other. So for those people, there's a couple, like we said, there are a couple of stretches and stuff like that you're going to have to do prior to your, stretching out your adductors and your glute activations and things like that, in order to make that feel good. But that should feel good eventually. Like this should not be something you avoid. You should be able to go up and down the stairs in your house if you have stairs in your house. You should just be trained how to do that properly.
Yeah.
Yes, sorry.
No, there was something that Hannah and I want to make sure that we mentioned as well, is that if you are trying some of these techniques and you're finding it's not quite resolving, something good to know is sometimes, so for example, SI pains, where we go here, tailbone pain, hip pain, can sometimes be disguised as coming from your low back. So something going on with your low back may refer to these areas. So that's why it can be good if it's possible to see someone in person, because then they can assess, is this coming from your back? Is this actually coming from your pelvis or the pelvic girdle? So just to be aware that sometimes pain can be referred from other areas. It may not necessarily be from your pelvis. So just something we wanted to bring up. And as healthcare professionals, we're all trained to be able to do certain tests to help decipher where the pain is actually coming from.
Right. The interesting thing I find is that most clients who come in with this kind of pain when they come in, they say, I have low back pain. And then we have to tease out, is it low back or pelvic girdle pain versus somebody coming in and saying, I have pelvic girdle pain. And then us trying to figure out if it's low back. It's usually the other way around. But you need to rule out that low back before you can start to assume that it's pelvic girdle pain for sure.
Yep. And sometimes there may be actually a link from both that both may be contributing as well.
A little column A, a little column B.
Yeah. So anyone who's just joining us, make sure watch all the way till the end, but then go back and watch the replay because we talked a lot about pelvic girdle pain and a lot of the myths that you might have read about, or if your pelvic girdle pain isn't going away, things that you may want to try. So we talked about, different exercises you may want to try as well. And then, so some of the resources, just to recap, because we did talk about most of them, is so Cecile Rost, which is, she is a physio from the Netherlands. She has a course for healthcare professionals. You can also find her book on Amazon, which is great for clients as well as health professionals. We'll link that below, or anywhere online you can find it, but I always end up sending
it. Are you link to Amazon? Because that's exciting. Okay, great.
Yeah. So there's a book, and then the free app that Hannah talked about. So it's called Rost Moves Mama, and it's a free app, and it's basically got pictures and descriptions of how to do things throughout your day that will help to, balance out what we talked about in terms of the muscles and help decrease your pain. So even like from grocery shopping, that's another common thing, right? Pushing the grocery cart, making people. She actually has pictures and techniques of how you can do that a little bit differently to help your pain, whether walking, stairs. She talks about, even turning in bed, positioning in bed. So, and it's free. So if you have access to adding apps, check that one out as well.
Yeah. And that's it takes away all the, we're frozen again. Are we frozen again?
Oh. No, I can see you.
Okay, Jennifer, we're frozen again. And the app kind of takes away the guesswork so that you're not worried about what should you do in this posture? How should you perform this properly? It kind of gives you details so that you don't have to think about it. You can just follow instructions.
Yeah, no, it's excellent. And then we'll also link below that video I mentioned that I made just with the posture and then the turning in bed technique for anyone who wants to take a look at that.
Awesome.
Yes.
Beautiful. So, again, I think, you've said this a million times throughout, but I just want to emphasize that these are just general recommendations. And please, if you're experiencing any of these symptoms and some of these suggestions don't work, you should definitely go be seen by a healthcare provider who can address your personal needs and personalize it so that, your exact specifications are met and that you are being treated for you, because everybody's a little different.
So Hannah, where can people find you online?
So you can find us on our website, vitalphysiotherapy.com. We're on Facebook, Vital Physiotherapy and Wellness Toronto, and we're on Instagram, Vital Physiotherapy and Wellness. And Anita, where can people find you?
Yeah. So you can find me, my website is holistichealthphysio.com, and you can also find me on Facebook or Instagram at Holistic Health Physio. And I wanted to make sure I didn't forget is Hannah has an awesome event coming up. So if you're in the Toronto area, something you could definitely catch. So Hannah, do you want to share a bit about that?
Yeah, we're going to be doing a birth prep workshop. It's going to be a free workshop. The end of March, we're going to be talking with naturopath and doula on how to prepare your body. Kind of, again, more of stuff that you're not going to find on Google. So stay tuned for some more info about that. And we also have a really exciting prenatal yoga workshop coming up. And we'll be releasing some more information about that. And that's also going to be end of March. And that will be a series. So we're very excited for that.
Amazing. So yeah, we'll make sure to link below. Oh, Talia commented as well. Let me check that here. So she said, my first health care provider told me the wrong stuff. Thankfully, Hannah got me on the right track. Everyone should be discerning with the professional that she sees. That's fantastic, Talia. Thank you for sharing that information. And yeah, everyone has different backgrounds or different training. So sometimes it's finding someone who's the right fit to help your specific pain and your specific needs as well.
Awesome.
And so we want to make sure, in terms of, so our next Facebook Live, we want to let you know is actually going to be on what is pelvic health physiotherapy, because we do talk about this kind of a little bit in each episode that we've done, but we're going to kind of talk more about what's involved and kind of more broadly what we see as pelvic health physiotherapists, how we can help you, and we're going to answer a lot of common questions in general about pelvic health physiotherapy. So if you're pregnant or thinking of becoming pregnant, or you're a new mom or a seasoned mom, you're not going to want to miss this, because it's, again, information not a lot of people get to hear about. So to be sure to like the Holistic Health Physio Facebook page and the Vital Physiotherapy and Wellness Facebook page, so you'll stay in the loop of when our next Facebook Live will be. So thank you so much for joining us and chatting today, and all the amazing questions and comments.
You guys are awesome.
We're going to be posting the replay shortly. So if you're just catching us at the end, it'll just be a few minutes, and then you can jump back on and watch right from the beginning all the pelvic girdle pain information that we shared, and how to get rid of it so you don't have to deal with it anymore. So, and
my bum demo, don't miss out on that.
So thank you so much for joining us, and make sure leave a comment, send questions, as well as any questions for upcoming Facebook Lives you would like us to address. So thank you so much for joining us, and we're excited to chat again soon.
Have a good night, everybody.